Dear ladies and gentlemen, my name is Monika Ferlitsch from the Medical University Vienna.
And my name is Elisabeth Waldmann, and today we want to present to you the results of our study on differences between men and women with respect to colorectal cancer mortality despite screening colonoscopy.
The story behind started 17 years ago when we have established a quality certificate for screening colonoscopy in Austria. Within of this database, we could show in 2011 that the men are double as high affected from colorectal cancer. They develop adenomas double as high compared to the women, and they develop them 10 years earlier than the women. And this study is the update of this data in respect to mortality.
So to tackle these questions, we retrospectively analyzed around 320,000 individuals who underwent screening colonoscopy within a national colorectal cancer screening quality assurance program for colorectal cancer screening in Austria between January 2007 and December 2020. Our results. So the mean age was 60 years, and the sex distribution in all age groups was almost identical. As expected and as we have seen before, like 10 years ago, men had significantly higher odds to have an adenoma or serrated polyp, a low-risk polyp, high-risk polyp, or colorectal cancer detected at colonoscopy than women. For the risk group definition, we used the current ESGE guidelines. What we found in this paper was that strikingly, male sex, when compared to female sex, was associated with an almost twofold increased risk to die from colorectal cancer when an adenoma or serrated polyp, and a fourfold increased risk when a high-risk polyp was found at screening colonoscopy. The cumulative incidence rate for death of colorectal cancer for 60-year-old individuals was 8.5-fold higher in men as compared to women. Markedly, this gender gap narrowed with increasing age, while the difference in death of other causes remained the same.
So, Elisabeth, I want to ask you, what do we conclude from the study?
Well, in the end, we don't know what exactly the background of this gender difference is, but we can see that it's there, and it's only for colorectal cancer and not all-cause death. So therefore we conclude that it might be hormonal reasons and that we need gender-specific surveillance strategies.
Yes, I think this is the most important message to all of us performing screening colonoscopy and collecting the data. We need a gender-specific surveillance for screening colonoscopy, especially for men. Thank you for your attendance.